Well, hello guys, back again with another video. Today we'll be discussing the joints and the classifications of the joints. You are required to know this according to your syllabus. This is the second point within the syllabus after the classification of bones. So joints, you have to know that they are classified into three main groups according to their structure. First, the fibrous. Second, the cartilaginous. Third, synovial. The first group's fibrous, it's made up of two types, the sutural fibrous and the syndosmosis. You have to know those two types, and for every type within a main group, you have to know examples of it, and that's how Sariski wants you to present it. So for example, fibrous joints have sutural fibrous joints, and they have, it's like a fibrous tissue that connects the two bones present. So within the sutural fibrous joints, you have the sutures, and these sutures are found between the bones of the skull, and these protect the brain. So between each bone within the skull, you have fibrous joints. For example, between the two parietal bones, you've got a fibrous joint. Okay. Next, syndosmosis. It is found to have an interosseous ligament that connects the two bones together, and they're found either between, as shown here, the tibia and the fibula, or the radius and the ulna. Okay, so these are two examples of the syndosmosis. So keep that in mind as you study those classifications. You have to know examples of each, and you have to know what it is made up of, and stuff like that. So you have a general idea about the knowledge. Gumphoses next. The fibrous joint is not only made up of two, it's made up of three. Gumphoses, there's also fibrous tissue that connects the tooth where the conical process and a deep socket. So the teeth is found to be articulating with the bony socket by a fibrous ligament. Okay, so this is the fibrous joint group. So when he asks you what is an example of gumphoses, you speak about the tooth. For example, the syndosmosis, speak about tibia, fibula, or radius and ulna, the interosseous membrane between them. Fibrous joints, any suture joint found within the bones of the skull, for example. Okay, so here that's the fibrous joint. Next, cartilaginous joints. They're made up of two types, the primary cartilaginous joint and the secondary. The primary is made up of synchondrosis and symphysis. Synchondrosis, this means no movement whatsoever. Symphysis, a little bit of movement. The difference between both is that the primary one has hyaline cartilage. An example of it is at the metaphyseal plate or the epiphyseal plate found between the shaft and the ends of the bones. Okay, epiphyseal plate, yes. Between the epiphysis and the metaphysis of the long bones. Okay, these are found within humerus or maybe the femur. Okay, next, the secondary cartilaginous joints, they're symphysis, so there's a little bit more movement here, but what it's replaced here is the fibrocartilage instead of hyaline cartilage. An example of secondary cartilage might be joints between the manubrium and the body of the sternum. Okay, at the sternal angle, maybe the intervertebral discs between the vertebral bodies. These are also secondary cartilaginous joints. The symphysis pubis between the two hip bones. So pubic symphysis has the secondary cartilaginous joint, an IV disc between the two. Okay, so nothing else to be said about this. We're going to move on. That's how simple you guys should be studying this. Next is the third and the longest part, synovial joints. The difference here is that there's so much movement involved within synovial joints, and they are split into so many groups. Things to be said about it is that there is always going to be a fibrous capsule around the joint. Sometimes you can find hyaline articular cartilage that covers the opposing articulating surfaces. So this is mainly it, and there's a synovial membrane. So just a general idea about the synovial joints, but then the most important stuff that you need to know is the types of synovial joints that Sariski loves to always ask about. We're going to dive into it. Here they are. You have first a plain joint. Plain joint is where two bones meet together and they're completely flat. So there's a sliding movement. As you said, only sliding motion. An example of this can be the intercarpal and intertarsal joints. Intercarpal is between the carpal bones. Intertarsal is between the tarsal bones. Or the acromioclavicular joint between the acromial process and the clavicular process. And then you have finally the sacroiliac joint between the sacrum and the iliacus, iliac part of the pubic bone. The pubic bone. This is the plain joint, so you have to know what it is exactly and maybe 3 examples of each. That's what Siersky likes. The pivot joint, for example, this is where supination and pronation movements are present, such as the it's a joint that acts as a pivot. So you have to know actually these definitions. So it consists of a central bony pivot surrounded by a ring, which is partly bony and partially ligamentous. So here it allows for only rotation. So this is an example of this motion range of this joint. So an example of this joint would be the superior radioulnar joint or the more distal radioulnar joint. These allow for the motion of the hand in this way. And maybe the atlantoaxial joint, where the head rotation from right to left. That's an example of a pivot joint. Next, hinge joint. Hinge joint, it resembles a hinge of a door. So here you can find this motion to be for flexion and extension. So elbow joint, this is my elbow. If I flex it or extend it, that's an example of a hinge joint. Or the ankle joint, or even the knee joint, that you can flex or extend it. Okay. Next, the ellipsoid joint. This is an example of the wrist joint. It consists of a convex over surface or elliptical convex surface. This allows movements along with flexion, extension, and abduction and adduction. So what this means is, so when I say flexion, extension, or I'm going to say adduction, abduction. So these 4 movements is called an ellipsoid joint. The condylar joint, for example, movements occur only in one plane, and a knee joint is part of the bicondylar joint. So these are just examples of those joints. Next, we're going to move on to the final one, the saddle joint. The saddle joint here, for example, is the carpometacarpal joint of the thumb. So this part right here allows the thumb to have so much movement, and this is an example of a saddle joint. Okay, the ball and socket joint is just very clear, whereas a ball fits inside a socket, such as the humerus fitting inside of the articular surface of the scapula, or the hip joint, where the femoral ball inserts into the acetabulum of the pubic bone. So you have the shoulder joint and the hip joint. We can dive more into those, but maybe on a separate video or a webinar, you can ask me all of your questions about some doubts that you may have. But this is it. This is the classifications of the joints and how Siersky might want you to understand them. So just spend some time trying to understand each joint one by one and giving examples, at least 3 of them, when it comes to different types of bones. Okay, so as I said, fibrous, cartilaginous, and synovial. And within the fibrous, there are 3 types. Within the cartilaginous, there are 2 types. And the synovial, there are 6 to 7 types that we have seen just now. Thank you guys. Hope to see you guys in the next video.